In a recent U.S. Census Bureau, over 195 million Americans were surveyed, and they report 69% of them reported that they feel anxiety a couple of days a week, and over a third reported they feel it most of the time. Hello, my name is Dr. David Palmiter. I'm a professor of psychology and counseling here at Marywood-University. And on today's edition of Mental Health Matters, we're going to be discussing a variety of things about anxiety disorders, which is one of the most common categories of mental health challenge in America. I'd like to begin by introducing my panel. To my immediate left is Samantha Christian. Samantha is one of our stellar undergraduate psychology majors here at Marywood. Next to Sam is Dr. Amanda Luchansky, who's an alum of our doctoral program here and also has a thriving practice in Clark Summit, Pennsylvania. Next to Dr. Luchansky is Dr. Natasha Coy, who also is an alum of our doctoral program and also has a very busy, active, and vibrant practice in Clark Summit. And last but not least is Dr. Lindsay Phillips. Dr. Phillips is an associate professor of psychology and counseling here at Marywood, has a private practice, and she is the president of the National Association that grants board certification to clinical psychologists. Welcome, everybody.
Thank you.
Thank you.
So let's begin with when clients come in and they come to us for anxiety, we say, what brings you in? Folks will usually tell us first about their stresses. So what stresses are you finding are most commonly reported to you that are driving people's anxiety?
I think, sort of the typical stresses, work, home life, finances. But I think, since the pandemic happened, I've seen a lot more people concerned with health. That's definitely been something that has picked up a bit in the past few years.
Mm-hmm.
I think a lot of anxiety is related to connection, how they can connect with their loved ones, how to manage conflict in their lives.
I sometimes see people who have more global anxiety. So sometimes folks come in and it is more of an anxiety disorder and not related to stress. But when I see folks that it is related to stress, I would say it's what my colleagues here are mentioning. In addition to that, definitely children, family, and I see a lot of couples. And so sometimes it's related to that stress, maybe in the marriage environment, and how we can help them work through those conflicts. So maybe to summarize, maybe kind of global stress, I mean, really it could be coming from anywhere.
I'm interested in what Dr. Coy just said here about connection. Is that back to what it was before COVID? Is it different? What are you finding about that?
I think the nature of how we connect has shifted primarily with a reliance on social media and different interfaces like Zoom, and that impacts how we connect to people, either not seeing people face to face or just looking at people from here to here.
One of the things that I've noticed is that it seems harder for some people to get out of the house after COVID. We didn't have very full schedules. We didn't have to really, go out of our way to be places. And I think as some of the restrictions have rolled back, the increased social demands after a couple years of having very little demand has been a challenge.
So in terms of social networking, do you see that as driving any anxiety or connected in any way with the anxiety people are experiencing?
One of the things I've noticed is that people tend to be a little bit more anxious with face-to-face encounters. I think people, a lot of people, if given the opportunity, would prefer to email versus making a phone call, or do a Zoom versus, meeting someone in person. So it's been interesting to see that shift. And I think that some of, our younger members of society are far more comfortable with technology. So I think that's definitely impacted their willingness to use it.
With some of my clients, I've worked on different strategies. They almost seem to need different strategies to connect in different situations. And so what might help them in a Zoom meet? So there might be a different stressor in a Zoom meeting. So we might need to think, well, what might help you in Zoom versus what might help you at a religious service that's face to face, if that makes sense. We've also talked a little bit about what might affect different generations in terms of social media, or what stressors might be caused by social media, what stressors might affect kids versus what stressors might affect parents in regard to their kids. And so I think those are changes that we're facing, related both to COVID and just related to the times that we're in right now.
Samantha, what about students? What do you think is making students anxious these days?
I definitely understand the connection part of it. We still have some professors using Zoom instead of in-person classes, and so just having to deal with both is stressful, like adjusting wise.
I'm going to ask you about that later. I'm interested in that. So before we get to the different kinds of anxiety disorders, I think we should just talk for a minute about how anxiety can sometimes be adaptive. What do I mean by that? Like, how can anxiety be adaptive?
Well, I think, in our hunter-gatherer days, it was appropriate to fear, like a bear or a lion or something that could really hurt you. And I tell clients that we don't want to get rid of anxiety completely because it does serve a purpose, but we want it to be more appropriate and manageable to the situation. So, if you're feeling a little anxious before a big game, that's good. Sometimes it keeps us on our toes. But if you're so nervous about doing everyday things that it feels like an impossible task, obviously that's not adaptive.
Yeah, absolutely. Anxiety tells us a story in moderate amounts. It gives us information, it makes us work harder, but at moderate levels, it tends to shut us down. It turns from a story to a megaphone, and one we have difficulty turning off or
I'm going
controlling.
to use that line in my own practice. That's a good line. It tells a story. That's good. All right, so let's talk about because there's a lot of them, the different kinds of anxiety disorders. Sam, can you share with our viewers the most common anxiety disorder?
Yeah, so the most common anxiety disorder is generalized anxiety disorder, and that just involves excessive worrying that comes along with physical symptoms.
So you resolve one worry and it seems like two more are behind it.
Right.
And you're never done worrying. Yeah. Do you guys want to say anything about the generalized anxiety disorder?
Worry can be so incapacitating. We are looking for every possible solution to every possible problem. And once in a while, rarely, we might find success with it. That worry thought, we figured this problem out, except for most of the time, it gets in our own way. And it makes it difficult to discern between thoughts that help us plan or prepare, and then thoughts that just make us stop at the tracks.
What about post-traumatic stress disorder? What can you tell our viewers about that?
This is something someone experiences after having exposure to a trauma. And we're learning more about what a trauma could entail. It could be diverse. And so a lot of people could think of this, a lot of people associate this with veterans, such as folks who are in wars, but it could be diverse, such as an accident, a sexual assault. And after this event, there can be a re-experiencing of the event. Folks can be hypervigilant, but they can also experience things like numbing. And so there can be a wide variety of symptoms that are attached to that after the event. And when folks have an event like that, it's good for them to get treatment shortly thereafter because it may or may not develop into PTSD. And so there are some appropriate coping strategies afterwards that can help them. And so that is post-traumatic stress disorder. So it develops after an event. But if there are some coping strategies afterwards, that might help prevent the onset of that disorder.
Worry, intrusive thoughts literally change our behaviors. And when we change our behavior in relation to something that is very stressful, whether it be remembering an event that's happened in our lives, we engage in that behavior over and over and over again to try and relieve that stress. While it feels like it helps us in the moment, generally it causes a lot more distress over the long run.
Do you find a difference between those who have experienced a single event trauma versus those who have had multiple traumas? You know, maybe there's a family member that's been sexually assaulting a person repeatedly, or a person's been in combat, multiple combat challenging situations. Is the PTSD different then?
There's more and more research on that. And so they are finding that there's a different type of experience with someone who's had multiple traumas. There's newer distinctions, and there's discussion of what they call complex trauma. And so folks who've even had, for example, even like a long-term, even emotional abuse in the household, that experience of trauma might be different, and their anxiety, what they might experience might be different in terms of what they might experience in terms of avoidance behaviors, anxiety, and their ability to, because it's been endured for a long term, it might almost seem as if it's ingrained in who they are and how they experience life.
Yeah, tightly woven tapestry of sorts.
So let's shift to obsessive compulsive disorder. What can you tell our viewers about that?
You know, it's when I talk to people about obsessive compulsive disorder, you know, it's one of those things where, you know, it may start off as, you know, not very intrusive, not a big deal, but it tends to become misapplied. So if you have somebody, for example, who worries about cleanliness, you know, obviously that could be a good thing until it starts interfering, you know, with how you function, your relationships, when it really starts to take over your life. And when we look at these things, you know, we examine them and try to hold them up to logic, you know, it doesn't make as much sense, you know, as the person thinks. You know, they're not getting the benefits, you know, that they think. There's a lot more cost to it.
What I found with COVID was this surge of health anxiety.
Yeah.
I wonder if you can speak to that.
A lot of people, I think, I remember when there was a doctor who was talking about the sterile method for wiping off groceries. And that became a very big deal. And I mean, we're talking like one hand touching the dirt, one being clean and not cross-contaminating. So obviously during COVID, it would be beneficial to, you know, be clean and hygienic. But it would get to the point that it stopped people from living their lives. You know, that even when, you know, there was a degree of safety, that it was still hard for them to do that. And then what they applied to their groceries, it was, you know, anything that came from outside would have to be decontaminated. And really the bulk of their time was then spent trying to clean products and materials.
Can one of you tell, because sometimes I think we're so familiar with these things, we forget what we need to explain. Can you guys talk about the difference between like rituals and obsessions, like how they connect to each other?
So if we return like to obsessive compulsive disorder, an obsession is a thought, and a compulsion is an action that you would do. And so if I would have an obsessive thought about cleanliness, a compulsion might be that I'd wash my hand. And we all have like little rituals. I for example, check that I lock my door a lot, and that kind of becomes a ritual. But the question is it compulsive?
and the amount of time it takes up.
And and I would say actually to viewers, if kind of anything we describe, even actually Dr. Luchansky, when you were describing kind of our cleanliness, I think if viewers would relate to things, actually everything we're describing, we all probably do pieces of it. We probably all have worries because it's kind of on a continuum. And so I would think for everybody to think, if we all do little things, if they're not time consuming, we might all have little pieces of this. It's if it gets concerning to us, if it gets time consuming, if it's interfering or very upsetting, that's when we would want to see a mental health professional, because a lot of us do these things and anxiety is so normative. We would want to see, is this truly a concern that it reaches a clinical level? So all of us have maybe little rituals that we do, but it might not be a disorder. Now, that doesn't mean it might not be helpful to talk to someone to help us.
So what about social phobia? What's that?
I think for many who have social phobia, there is this very strong concern or worry of being judged or criticized, ridiculed, or rejected. And to the point where people will avoid social settings. They might not be able to call in order to take out. They might be worried walking on the street whether someone's going to stop them and question them about why they're there or what they're doing. A lot of students will talk about that in the classroom and presenting publicly, but I see it in people of all ages.
So there's ones we're not getting to for time, panic attacks, agoraphobia, specific phobias, but the idea is said by Dr. Luchansky, it's just anxiety that's interfering with the quality of a person's life. What kind of co-occurring problems do you find can exist when folks have an anxiety disorder already?
A lot of times I say to people, what goes up must come down. So when we're anxious, we're usually very alert, hyper aroused. And, you know, people can't maintain that. And sometimes it can lead to depression. Our anxiety may stop us from doing things that we really want to do. And even though there's that immediate relief of avoiding that uncomfortable situation, what I see is that people often feel bad afterwards that they didn't take that chance. So depression is definitely one that I see often co-occur.
How about alcohol?
Absolutely. Yeah, any sort of behavior in excess that is used to manipulate a feeling that they have. So alcohol use, absolutely, but also cell phone, internet use is another example.
I was going to say something similar, and maybe, I don't know, Sam, if you can add to maybe what you think college students do in this regard, but any type of unhealthy coping. So I would think we would kind of look at, when we have anxiety, what are healthy versus unhealthy ways of coping. And so maybe I would think of like, what do young people do? And Sam, you don't have to say what any of your friends do, but kind of I think what are healthy versus unhealthy ways. And so things that I would think of co-occurring might include alcohol or drug use versus healthy ways.
Which is up next.
Yeah. Oh, okay. But I'm not gonna steer you under there. But Sam, I don't know if you can think of any unhealthy things that you would think young folks would do.
Off the top of my head, I would say definitely the internet use, social media. Definitely when I know some people feel anxious, they just grab their phone and they just scroll. Yeah. So that's definitely something.
All right, so let's shift to what people can do about it, because I think we all share an opinion that these things are often highly treatable. What's cognitive behavioral therapy?
When I explain CBT to my clients, I tell them, you know, we all think a certain way. So if we change how we think, we can change how we act, which changes how we feel. Anxiety is something that is very reinforced. So if I don't like returning phone calls and I just don't do it, you know, the next time that I get a phone call, I have to return my instant, you know, thought is going to be like, I'm just not going to call back. So we want to start to break those patterns and kind of look at, what is preventing you from doing something? Why do we feel that way? How does that hold up? Is there a different way to think about it? And if we think about it differently, can we do something differently?
What I share with my clients is looking for the bigger, better offer. We have relief in the moment when we do things to relieve our anxiety, but it may not always help us in the long term. So we have to maybe use some mindfulness strategies and looking forward to.
What's that?
Mindfulness is building an awareness kind of real time in the moment, how our body is responding to an experience. For example, in anxiety, our bodies tend to peak in some way, whether it be a knot in your stomach or flutters in your chest. And so we might do that thing, get on our cell phone, but our bodies will return to normal whether we pick up that cell phone or not. And seeing that bigger, better offer of, I don't have to waste hours scrolling when I'm anxious. Instead, I can tune into my body and recognize that that feeling will subside just by nature of us being present.
And we can teach some easy mindful strategies to promote that non-judgmental awareness. So we can teach folks some strategies, like instead of turning to the cell phone, there are some little simple strategies that we can teach you. So examples include things like deep breathing. And even those of us with kids see that they teach them on shows like Sesame Street. They teach these strategies, but we can teach clients deep breathing strategies that work for them. So for example, when I deep breathe, I like to count when I breathe in and out, because I find that if I'm counting, I can't worry, and my worries can't go on in my head because I'm counting. I can't simultaneously count and worry. Some people they breathe with their fingers. So breathe in and out as they trace their fingers. That's a strategy that's easy to teach kids. Or even another mindful strategy that's fun with kids that we did. We do this at Healthcare Discovery Camp that we host here at Marywood with kids. Is I know a lot of other people do this. We make glitter jars. And so even something as simple as making a jar and being able to watch the glitter. I know personally adults who like this too. I don't know if other adults like watching that glitter. Just the ability to kind of sit and watch that glitter flow is another mindful strategy. So there's some strategies that we can teach folks that allow them to kind of have that skill. And some of them you can do in any setting. And so if I'm deep breathing, if a Zoom call makes me anxious, as we discussed earlier, you're not really going to know that I'm doing that to manage my anxiety. You can't tell that by watching me. And so that's a real easy strategy that no one would know that I'm even doing or that I'm anxious.
There's marketing dollars out there to make people aware about medications for treating anxiety, but there's no marketing dollars to educate people about cognitive behavioral therapy. So I think if I was someone watching and I was taking medication for an anxiety problem, but I had never received cognitive behavioral therapy, I would be very interested in finding out what benefit it might accrue for me, just in case I might not need a medicine at the end of the day. Sam, you have some coping strategies also. Anything that Dr. Phillips didn't mention yet?
I do. One for sure was the deep breathing, and I feel like that is super helpful even for myself as a student. I feel like that's just something you could do quick right before class, right before a test, something like that. Also, exercise, physical activity is very important. As a student, that's a little bit harder to do, to find the time to be able to do that, but that's important. And then just therapy itself.
So, Dr. Phillips, this one's for you because I know you do this kind of work. If behavioral treatments don't work for someone with anxiety, there is another option out there, insight-oriented treatments, psychodynamic treatments. Can you describe what's involved with those?
Sure. So there's other forms of therapy, such as interpersonal psychotherapy. And these would be for folks, and I would say in therapy, we know that there's different types of treatment, and you could look up online, look up different types of therapists, and they would describe the type of work that they would do. And you would certainly see therapists who would say, I provide cognitive behavioral therapy. That's a more structured approach. And so if you'd want someone who was more structured, definitely I would go with that approach. But if you were someone who maybe wanted to discuss maybe more things that maybe happened in your childhood, you might be more inclined to seek someone who provided psychodynamic therapy, or I provide a more interpersonal approach. And so interpersonal psychotherapists look more at your current interpersonal relationships and how they might affect your mental health. And so for somebody who was maybe thinking that their interpersonal relationships were stressors, that might be something that would be appealing to you. And so that's what you would look at. You would so if you would see someone who takes an interpersonal approach, and you would be thinking, I would improve the quality of my relationships, and I think that's affecting my mental health, you could look for that as well. Some of us might also say we're integrative. And that might mean that we might teach you both strategies and work on your things like your relationships. And so you could look for that term as well, integrative.
What do you guys find your success rate is for treating anxiety?
I think it's highly treatable. When people actually sit and think about their anxiety and explore it in a safe environment, it's not as unmanageable as they may think. I always tell them, the clues to beating your anxiety are within the anxiety itself. Oftentimes we're trying to ensure something happens or avoid something with our worry. And if we are curious about that and, try to understand that or what's giving rise to it, we can usually figure out what to do about it.
And everybody's nodding. So we're almost done here. I'll go around and let you each give a final thought that you'd like to share before we stop. Dr. Phillips?
I think a final thought I would have is, if you feel you can benefit from therapy, please reach out and know that if something's not working for you, there's something out there that is. And so if you'd reach out for therapy, let your therapist know if something's not working. We'll definitely have another tool for you.
I really appreciate what Dr. Phillips has just said. It's hard to add to that. I'll add that, or I'll encourage folks who believe they've had trauma in their background to seek out a trauma-informed therapist. And don't be afraid of asking a therapist you speak to over the phone whether they are trauma-informed, and if so, how do they integrate that knowledge in their practice with their clients?
I would tell people, if you're not sure if you need therapy, please just call and ask some questions. I always tell people, if I'm not the right therapist for you, I'm happy to try to help to get you to the right therapist. I don't think that, people know as much about this field as, let's say, the medical profession. They know what specialists they need to see, but this isn't, as clear cut. So call someone and ask, and they can answer your questions.
I think as a student, and just for myself personally, that it's nice to hear that there are ways to cope with it, and just because one way doesn't work doesn't mean that there's no hope at all.
That's it for today's edition of Mental Health Matters. I would like to, besides thanking my panel, thank the production team behind the scenes, the students, Lindsay Jason, Colby Hughes, Rubain Singh, Kyle Driscoll, and Nevika Molinara. And if I mispronounce any of your names, it's Mr. Mangoni's fault. And Ernie Mangoni is the master and commander of all things having to do with this production and anything in the studio, so thanks to him also. Please watch for us next month. I'm not sure what our topic will be because my student assistant isn't here, but it'll be really good, so look out for it. Till then, please remember, mental health matters.